Welcome back and thank you for staying with us. Now, the Department of Health has convened the second of a series of tobacco control webinars focusing on various aspects of tobacco products and electronic delivery systems control bill. This focused on the Global Adult Tobacco Survey, which had key results which revealed that South Africa has a huge burden of tobacco use, exposure to secondhand smoke inhalation, and a significant amount of money is being spent on manufactured cigarettes in a country with high levels of poverty. Let's discuss this further. We're joined by Dr. Lynn Moeng-Mahlangu, who is the Chief Director for the Health Promotion at the National Health Department. Thank you so much, Doc, for your time here on eNCA. Now, of course, we know that smoking is quite a huge problem in South Africa. What are the statistics showing you in terms of how many people right now are smoking?
Masifa, from the survey, the biggest challenge is that we have seen an increase in smokers. The last survey, we had about 21.6% of people who were smoking cigarettes, but the recent survey shows us that that number has gone up, or the percentage has gone up to 25.8% of people who are just smoking cigarettes. But if we combine it with other products, then we are talking almost 30%. This is a huge concern for us as a country. And maybe just to add as well, is the increase in the smoking, the age group that is smoking these other new generation products, your vapes, your e-cigs. We are seeing an increase in the age groups between 15 and 24%. Between 15 and 24, sorry.
And also, I guess there's also that concern about the illusion that vapor is supposed to help you quit smoking, or that it's safer than an actual cigarette, etc. There's also the problem with that illusion.
Yes, it is an illusion, because we are now aware, especially from the survey, that people don't necessarily stop smoking. We still have a huge percentage of people who have attempted to stop, who have not stopped. We have people who are using both cigarettes and also vaping. So the percentage of people who have actually stopped from the survey, actually they indicated that it's very small. I think it's about 4% or so, but majority of people are either using dual products or continue for a long time. Actually, some have been using products for more than 2 years as an indication that once you are in, you are in. It's not easy to get out. So this is the issue that we are trying to address. For as long as we have products that have nicotine, it means we are trying to identify new addicts.
And also, Doc, I don't know if you discussed this at all, and you can tell us exactly if you discussed it, exactly what you discussed. South Africa also has the problem of illegal cigarettes making its way into the underground market in our country. We saw it even growing further during the time that South Africans were told that they're not allowed to buy or sell cigarettes during level 5 of the lockdown. But we saw people still smoking different brands of cigarettes from, I don't know where, making it into the country, etc. Is there concern from government side on the fact that we still have some of these cigarettes actually being bought?
Yes, it is a concern, and we do need to indicate that the one issue that will address the illicit cigarettes is having a country that has a strong tracking and tracing system that can track and trace where cigarettes are coming from. This is one area that we are fighting for. Although there is a narrative that if we publish the bill that we are currently working on, there will be more illicit cigarettes, but we had illicit cigarettes even when we didn't have a bill. So for us, the issue of illicit cigarettes has to be addressed with a proper tracking and tracing system for the country. There's also some evidence which has been presented by some of the researchers that some of the cigarettes that are called illicit are actually produced by the same companies that are producing cigarettes. That's something that is coming up and surfacing, and possibly whoever is saying it, it means they do have evidence of that. So some of the cigarettes are not necessarily coming from outside, they're produced here in the country with the pretense that they'll be exported and they end up remaining in the country.
And that is, of course, quite a concern, especially after looking at that survey that showed us that in South Africa we are actually more and more in danger. And as a doctor, are you concerned at all by people who are possibly getting sick, probably getting different cancers because of smoking in South Africa? Are those statistics also growing? Any of them that are linked directly to smoking?
Yes, definitely, both to you as a smoker and secondary smoking. I do just need to share this quickly with you before I can respond to all the issues.
Yeah.
Last week, I was in Durban and I met a lady who, just at the lift, who didn't even know me, who is saying, I'm going downstairs to try and get assistance because I was put in a room that is for smokers and I'm asthmatic and I'm blocking. That's the reality out there. But then you are talking about our concern. Yes, we are very much concerned. Researchers are telling us that as a country, we are spending something like 14 billion to treat tobacco-related illnesses, your lung cancers, various, because tobacco affects your whole body, not just one part.
Yeah.
I know that there are people who will be saying, I've been smoking all my life and I'm still alive, I haven't died. When we develop policies, we are developing policies for the public, not necessarily for individuals. So if statistics are telling us the numbers that are affected and the admissions in hospitals due to smoking are higher and the treatment is costing so much, it means we are actually losing as a country because of the treatment and the cost of treating tobacco-related conditions, which is an area that we definitely do need to address. We talk lightly about when someone is coughing and then you're saying, oh, that's a smoker's cough. And they say, oh, yes, that's a smoker's cough. But that smoker's cough is an indication that those lungs are finished. It's a bigger problem.
Yeah, absolutely, Doc. Thank you so much for speaking to us here on eNCA. That was Dr. Lynn Moeng-Mahlangu, who is the Chief Director of Health Promotion at the National Health Department.